the recording of the session. And yeah, thank you so much, Casey, for saying yes to coming to my class. And yeah, over to you. Casey, we can't hear you. Yeah, again. We can't hear you again. Is there any issue with your mic or your speaker? And then yeah, over to you, Casey.
Okay. So thank you so much for inviting me. Doria, it has been a while. I've seen you. I think last mention was count in 2 digits already. Yeah. All right. So I just introduced myself. I'm actually very happy to be invited because as part of I will tell myself a little bit more about my background, and I'm really happy to come back to share about this topic also. Maybe just a little bit of myself. You can just call me Casey. So one is to I do not need to show how old am I and things. So I still want people to call me, my name instead of call me Miss or Madam or anything. My children's, my students like to call me Miss. So yeah, that's okay. So by profession, I'm a clinical psychologist. So maybe just a little bit of introduction. What's the difference between psychologists or any other things? Other things in the mental health field later. So yeah, I'm going to share my screen here. So let me see if that's work. Okay.
Yes, it works.
Okay. All right. So today I'm going to share about this topic. Therapy isn't a magic, but it's close. So turning failures into light bulbs moments. So what is my I think I have mentioned about my professions as a clinical psychologist. So my main task is actually to do a therapy. So my topic will actually evolve around therapy sessions. So if anything's unclear, it's really normal. So I'm inviting all of you. If you have any questions, just let me know. I actually, when I share the screen, I actually cannot see all of you. Will be nice to have some sounds or nods or anything that can hear me that I need to give the attentions back to you all. Yeah, that would be nice. So I will continue. So in these sessions, I'm actually expecting a little bit more interactions because I put it there as sharing objective. It's not a teaching objective. It's not a therapy objective. It's a sharing objective because I take this as a sharing sessions that I can interact with all of you. So everyone can actually take this chance to ask me some questions in terms of this field or anything that you think might be helpful for you also. In to the extent that you feel safe and comfortable to share. All right. So I will be actually sharing about how to explore how these missteps leads to breakthroughs in personal and professional life, to encourage flexibilities and adaptabilities when facing challenges or missteps, to understand the balance between tools and human connections in the therapy sessions, or we call it as therapeutics process. So some disclaimer that I would like to put out is because I'm going to share some of the case studies. So some of the contents I have have modified it to the extent that to protect my clients' privacy and confidentiality. So yeah, it has been modified. So just to let you all know. And also I'm aware that this is being recorded also, so I'm trying to take a step back that not to tell too much information, but to the extent that I can share. Okay, something about myself. So I'm actually born in Malaysia, in Selangor, at this town called Cheng. So anyone knows about it, then can say hi to me, or later on, you can interact with me. So in the family, in terms of a family order or child order, I'm actually the second child of 5 siblings. I'm also a daughter for my mom, my dad. I'm a nephew for my. I have an. Sorry, I'm a cousin's. I'm the aunts for my nephew. So I don't have any childrens or anything. I think earlier on, me and Doria was sharing about coffee. Yeah, I'm actually a coffee lover. So, and sometimes I also consider or maybe thinking, do I need a drip or not? Because I am craving for coffee most of the time actually. So it is not so healthy. Yeah. So in terms of my education's background, I'm actually for study in UTM. So that's why I'm very happy to come back here to share some of the informations of sharing. So I'm actually parked under faculty in management. Last time we call FPPSM. I'm not quite sure if they changed any name or not. So I'm actually finished my degree there in industrial and organizational psychology. So after my degree, I explore my I put myself out in the working industry. So I worked for 2 years in a child development center, mainly focused on neuroscience and left right brains development. So in any case, in the future, you are the teachers, then this is some field that you maybe would like to explore. The WH there means working holiday. So after 1.5 years or 2 years working in the field, so I feel like, oh, I need to step out to look into something different, or to explore certain things in my life, just to put some sparks in my life journey. So I went to New Zealand for a half year, and as a working holiday packer lah. So after I came back from working holiday, then I straight away enrolled into master in clinical psychology in UCAM. And then the course took me about 2 years to complete. And then after complete, then I work until right now. So I have about more than 7 years in these professions, with multiple roles as well. So a little bit more specific, after my master program, and I got my master, so I actually put myself out into drug rehab center. So it's a private rehab center. So mainly deal with the populations which is quite niche and quite green also at the time when I was working. So I faced a lot of challenges. So I think it's a good topic for me to share. Right. So, and then I worked there for 2 years. Then I came back to Selangor. The drug rehab center is actually in Sabah. So actually I flew to Sabah for 2 years, stayed there alone, and then came back to Malaysia. Came back to Semenanjung, and then worked under KKM. So I was a clinical psychologist, alone and the only one in one of the renowned government hospitals in Selangor. And I worked for 4 years. And Ngam is a pandemic, so it's nice to see different things also when this happens. So I worked from 2018 until last for about 2022. Then I resigned. So I dive into private settings, includes clinics and hospitals. So I'm currently also part under Pantai Hospital Kuala Lumpur. And in 2022, I also set up my own center. So this is my personal identity view, and everyone has it. Okay, so how we see this personal identity view, because in our life, right, we have different identities. We have personal, we have professionals. Now we have so many identities in our life. Like as I introduced myself, I am also a daughter for my mom. I'm also an aunt for my nephew. Right, so those are my identities. But more attuned to myself, I'm actually a person who values a lot of sincerity, empathy, resilience, and also growth. So something in the middle here. I use ChatGPT to come out this, so I'm not quite sure if I pay enough or not to come out this. So some grammar mistake there, but I think fair enough lah to have what I have already. Okay. And then if you see the circle outside there, is mainly what I appreciate. So for example, I really appreciate strong connections with my family and friends. And then I would like to explore things inside my life. For example, traveling. I will go to the gym, and sometimes I feel very stressed, and do some slam ball helps a lot. And then yeah, mainly interact with friends as part of my maybe how I manage myself, and also explore the things in life. Okay, so come to the professional identities. So if you can see two logos here, so I'm actually the founders and the director for this center that I set up called Hummingbird Psychological Service. So on top of that, I'm also part under Pantai Hospital Kuala Lumpur. I'm a sessional clinical psychologist there. So I only go on certain days. So the rest of the time I'll be in my own center. So on top of founders and the director, I also do my profession work, which is a clinical psychologist. And then earlier on, I mentioned that before I have these sessions, I actually have to sit into my trainee sessions. So I'm actually a clinical supervisor role, mainly to evaluate and to, to train newbies out to make them qualified to be a real clinical psychologist. So on top of that, I also give a lot of talks and also workshops, whether or not to the universities or corporates. So what do I do in daily life? Then, so as my profession, I'm a clinical psychologist that will do assessments. So when clients comes in, I will need to check in how's their mood. For younger child or sometimes to the adults, I will also do some neurological tests, or like for example IQ tests, autism tests, ADHD tests, sometimes dyslexia tests, to help the clients to know themselves better, or what are their challenges when it comes to certain difficulties. So on top of that, I also do therapy, mainly talk therapy. So through talk therapy, I'm able to engage with the clients, understand their concerns. For clinical psychologists, we deal mainly clinical populations. So most of the clients who come to me are in the clinical range for maybe depressions, anxiety. Some people have OCD. Sometimes they have a combinations, like maybe autism with depressions, or maybe personality disorders, and etc. So I will be able to to give a certain interventions or counseling to support them. So to show you some of my pictures of my clinic, so this is a clinic that I meet my clients. So this is in Bantai, and this is my center. Okay, what else do I do? So you can see I do conduct the workshops and talks with the corporates. Sometimes we do have certain collaborations, so we will actually go and conduct some workshops. This is a talk that I gave, I think 2 years ago, and I'm still doing it. So apart from being a clinical psychologist and director, I'm also an administrator. So I need to pack things for marketing purpose. So I'm packing things. And then we go out to do some mental health screenings. And sometimes I'm a cleaner also, right? So it's like in Chinese, we call 包山包海. Okay, it's like cover everything. So it's not that easy to be a director. Okay, so before we dive in deeper, so I would like to engage with you all through this Slido. I'm not quite sure you're all familiar with it, but what you need to do is you can use your any gadgets that can scan this QR code, or you can actually log in into Slido and key in this number. Then I will be able to see it here. So what I would like you all to do is the first questions, which is this one. Bukan. This one. While having me to take a break and waiting for the response, if you have any questions, you can also ask me right now. So the question is, what comes into your mind when think of failure? You can see the questions, right?
Yeah, can.
Okay.
Question to you, Casey, while waiting for the rest to respond. on average, how many days do you spend in Pantai per week?
It's quite fixed though. It is 2.5 days.
Okay, so you're on rotation basis with a group lah, basically.
More like room sharing. There are days that I
Okay,
actually share with other therapists or professions. So I'm actually sharing room with a psychiatrist. So she will
okay,
take the time slot, and I'm taking the slot that I have. So I'll be there every Wednesday, Thursday, and Saturday half day.
okay.
Mm.
So is there a specialization that you do there, or is a general depend on client profile, anything, any case goes?
For me, I take in general. So means I take out
Okay,
all the cases, from young age to adult. But I try to see more adults in Pantai, because there is a
okay.
we also have other professions who specialize in child and adolescents.
Mm.
So that I will actually can focus more on adult case lah.
Because
Mm.
previously you mentioned you focus on drug rehab center, right?
Mm.
So for the profile of the clients might be different.
Yes, yes, it's very, very different, and the management will be different also. And because I'm specialized in these addictions, right? So even when I'm in Pantai, I'm actually still seeing clients who struggle with addiction cases. Mm-mm. So
You have very good response already. 15 people are already responding.
okay, yeah, I'm you guys
Yeah.
can see the response, right?
Yes, yes.
Mhm.
Mm.
Because I like to use this because I understand that sometimes it's hard to open up at the beginning. No, we need some warm up. So hopefully this is some warm up sessions
Mm.
also lah. Okay, so what comes into your mind when think of failure? So there are mixture of things. So I see feelings. Some people I see it is part of experience, success, and explorations to find out what's missing and make up for it. There are feelings that include disappointment, fear, anxiety, feel being vulnerable. Yeah, those are very, very common when we think about failure, right? Sometimes it's also very, very scary, because especially after the first time when you fail, the second time when you think about trying out again, wow, that can be very scary, right? Just like this person said, worried, nervous, and scared to try on that part. Yeah, it's really, really understandable and common, right? We have 16 participants, right?
We have 21. I think one of them are not here today.
Mm-mm.
So good figure lah. If you can continue or you can wait until 20 people responded. So it's up to you.
It's okay. I can just move on
Okay.
first. Yeah,
Yeah.
it's a good
Yeah.
numbers. I can see a mix of response already. So and not only me, I trust you all can see the response also when all of us think about the perception of failure, right? So of course, what's my perception is next. Next. Okay. I really like this person's Henry Ford about this quote. Failure is simply the opportunities to begin again, and this time more intelligently. Because each time when we fail, we learn something. Of course, the process is painful. Sometimes it's also suffering. But after a period of times, you probably would think of, is it worth it, or it is worth it, and maybe you have a full stop there. Yes, it is worth it, right? So I think because just now I saw something along the line saying it's a questions, it's doubtful, right? So especially when you would like to step out again, so it can be very scary. Yeah, I always tell my trainees these things. If you are not feel or take enough missteps in the sessions, you probably fail to be a therapist also. Yeah, because we need a lot of failure to accumulate to know what can be better, and then we adjust and we come back again. Yeah, this is very important. So when talk about therapy, of course, failures constantly happens in the sessions, and there are few components when we look into failure as that happens in the therapy. So because when we read the book, right, or we read certain textbook, it provides a framework, but actually clients live outside of the textbook. right? So theory doesn't always fit the messy real life situations when we hear from the clients, because the textbook is like this only, but the client's issue is just like this, right? So sometimes it's good to have certain framework, but not always it's hard to fit in. Sometimes we have to adjust also. All right. Then the second part is misalignment between therapists and clients' goals. And then the third one is cultural, contextual, or systemic factors that overlook. All right. I would like to do a small experiment. When it comes to the second point, misalignment between therapists and clients' goal. Can I just stop sharing and I'm going to give you some instructions? Okay, so I would like to have all of you to take a paper and pencil, and I might need you to show your video later after you write something on the paper. Okay, so are you ready? Okay, okay, I see a thumbs up. So I count 3, 2, 1. Then I'm going to give instructions. Can you draw a house? Okay, I'm giving you like maybe 1 minute. Then I will give the next instructions. Okay, all right. I would like to invite all of you to open your video and show what you have drawn on your paper. I'm not quite sure whether we can see all the pictures at one glance. Uh, so because the layout that I'm seeing um let me put in grid. Okay, all right. Yeah, if you don't want to show your face, it's okay. Just use the paper to cover the face. That's fine. Okay. All right. Thanks for your participations. Some people I can see. All right. I can only because I only have 6 grid. I only have 6 pictures. Okay. But based on this 6 picture, what we can see right now is when I give the same instructions, what's the result right now?
Different. Wait, almost the same, but then some different.
And what does it tell then? Same instructions or?
Different findings. So
Mm-mm.
it comes back to your first point tadi lah. Meaning you may have a set of instructions on how to do therapy, but then at the end, every one of us are doing different things.
Yes. Okay. That's that. So for example, when the client said, I would like to feel to be happy again. So my happy instructions, the client's happy instruction is the same across all like is that the same understanding according to mine? No, right? Because simply one statement, we all have a different perspective. So misalignment is super common. Right? I'm not giving a very complicated instruction, isn't it? I only give like, please draw a house, right? Yeah. So that happens in our life also. Sometimes when we give a simple instructions, but it turns out a lot of different outcomes. Okay, that's very, very common. Okay, so I continue share my screen. Okay. All right. So the exercise just now is to see, the expectations. Sometimes when we give certain thoughts, misunderstanding or misalignment is commonly happens also. Yeah. So that's why the failure happens in the therapy, because I have my own interpretations, client has their own interpretations. All right. So of course we acknowledge all the failures already. Oh, I have made this mistake. I took the wrong steps already. So how can we change all the failures into the light bugs moments? So I'm going to share a few cases here. Okay, so this is a case examples that include a systemic perspective. The systemic means the whole systems, how we see the interactions between self and the others and the society. All right. So I have this client of mine, have been seeing me for many years already. She is my long-term client. I started saw her when she was 13, and then now she's an adult already. So along the years, she has been doing very well. From initially school refusal, struggle with eating problems, and then slowly and gradually she managed to finish the school and finish SPM, and she scored quite well also. uh so seems everything is okay. I think in the very most recently, something happens in the system issues, because there's always one thing that I cannot help is the systemic issues, especially the clients' parents, marital issues, and there's a lacking of consistency when it comes to support, right? So much so I would like to help in terms of systems. Sometimes it's not what I can do. So that's the limitation, because it very much depends on the reciprocate from the parents, and also their involvement in the therapy process. Okay. So you see, sometimes when we already help the clients, but if let's say something bigger, we if there is no modification from the bigger perspective, uh things will things will be just there, and there are ongoing things that can't change, that actually will still hit to the clients. Yeah. So of course the lesson learned from here is, will be nice if let's say we can still include the family and some social resource in the intervention plan. And of course with this client I always advise, not advice, but more like giving to bringing the in perspective, especially not to just focus on one thing in life, but other things, other perspective in life also, right? Because she is someone that really care about her family. Okay. So sometimes bringing some insights about looking into different perspective, especially social resources, making friends, what's important to be independent, and interactions with self and others are also part of life, also very important. So maybe she still have some hope, where the families that can be better, but I guess sometimes we means me and my clients also in the process of learning to be to accept that there are things that cannot change also, right? So when it comes to this, when we say, oh, this is so helpless, right? Oh, how come I cannot help my clients, it's not something that we can do lah, no? It's important to acknowledge our limitations also. Okay, because it involves collaborations of others. Okay, so that's one of the examples. Sometimes I wouldn't say it's a totally or total failure, but rather maybe if I can do more. Sometimes I'm thinking if I can do more, maybe that will be helpful. But for this case, actually, I did what I can already. I also seen their families. I also asked them to see a couple therapies. Well, that happens. Yeah. Okay. So another perspective, cultural perspective. So this is also something that I learned in a hard way actually. Yeah. So I have this client when I was working, and she is actually from Middle East countries. So she suffered from PTSD with depressions, and she was referred to see me for individual therapy. So also talk therapy, because I actually focus a lot on individual therapy only. I don't really do family and couple. I do, but not fully dive into it as much as other people who take courses or certifications. So, but in terms of the joint sessions, I still do, but I focus a lot on individual sessions. So this person actually gave me a gift after the end of the sessions. She has to go back already. In our professional ethics, right? Actually, we cannot take gift. We cannot receive any gift. So that is our professional ethics. Of course, professional ethics has its own rules. However, you know, because I follow rules. So when the client actually give me the gift, right, and I said no, 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 I cannot take gift, like very, very, like a strong no, right? Because I am abide to my professional ethics, and the client was so upset, and appeared very disappointed. So, and I was a very green therapist at the time, and I was also very puzzled. Oh, what's going on? How come these reactions are? So I was like thinking and asking myself, and of course, asking myself this question won't help lah. So after I talked to my supervisors at that time, and then it is actually very important to look into a cultural perspective. Why it is so important? What is the meaning behind them to give a gift? Especially when it comes to their reasoning. All right. So then we find a balance between abiding to professional ethics and cultural consideration when taking in the gift. Okay. Of course, if the times can U-turn, right, or can return at the time, probably what I can do better is maybe I would like to ask my clients, because at the time I think it comes to the end and I have to say bye bye already lah. She has to fly back to her country. So if I have a chance, probably I will ask the clients feedback lah. Yeah. And I do it right now with certain clients who give me certain gift. I will ask them, like for example, is there anything, any meaning that why you are giving me these things? So for now, I am taking certain gift. If let's say when it comes to festive, because I understand maybe it's a festive, so they would like to share some appreciations. Sometimes they will buy me some Starbucks drinks because they are worried about me not drinking enough. But I don't think that's the purpose. But I guess sometimes I ask them, how come you buy two? It's buy one free one. Then okay lah, fair enough in a sense, not because of other meaning or other intentions. And then yeah, I from that onwards, right, I always ask my clients, is there any particular reason you will give me certain things, so to understand better before I reject anything. Yeah. So I was still thinking about this these things that actually quite bothered me quite a lot lah at that time. Mm-hmm. So another case example, which involved humans element. So this is a client of mine who has an ASD mean autism and depressions, who has difficulty to open up. So the initial challenge is because our usual way of doing session is talking therapy. So for clients who has autism, they have difficulties to convey certain message, right? So what I did with my sessions is actually I introduced board game. So when I introduce board game, the clients also kind of like able to express themselves through the activity, and they are also very, especially depressions, they can't find any joy and they cannot describe the joy. So when I can see the smile face on their in front of me, I will say that it's something that I have achieved, because sometimes certain therapy is just not working, right? Especially we really focus on just one thing. So I always tell my client trainees, we always need to have a lot of tools. If this doesn't work, have to change another one. If this doesn't work, we have to change another one. Of course, cannot change too frequently lah. We have to stick with certain structure and protocol. But we need to be flexible and be creative. Okay. But same case, I thought it's working, right? So very interesting. I also do the same thing to another client, and then what happened was the client actually reject and resist to play activities with me. And then he slammed the table and walked out from the therapy room. So you see, one same technique it cannot apply to all the clients, right? Even though they are struggling with the same issues. So that also give me a lesson that it's important to build trust and engage, and also highlights human. It's important to build the rapport first, because I think the second case, the rapport is not there also, and a lot of resistance will come to seek for help because it was brought in by someone else. So a lot of considerations when it comes to doing a therapy. Okay, so now it's your turn. You are the therapist right now. Okay, I'm going to show you this. Okay, so if let's say I give you this scenario, the client says that I feel like nothing in this therapy is working. So what do you think you would like to do? Okay. Okay, so we have 60% or 67% of people say explore what isn't working by asking the clients. Mm-mm. Okay, I will wait for one more. Oh, okay, two more. Okay. I would like to highlight that there is no right or wrong, yeah, because eventually you are the therapist. You decide actually what is the method that you would like to go further. Okay, of course, some people will say, okay, maybe we ask some feedback, lah, right? Explore what isn't working by getting some feedbacks from the client. Sometimes we can pause and to reevaluate some alternative. Sometimes when it comes to certain therapy protocol, there are some structure, so certain therapists they will prefer to stick to the original plans also. Okay, so actually there is no right or wrong. So you decide. Okay. All right. So next, so in a nutshell, what I'm sharing right now, just now, there are a few things actually I took. It's my takeaway through my journey to be a profession as a clinical psychologist, and also that also apply a lot in my life when I do my own setup, and also my personal life. It helps a lot because textbook is just a reference, yeah. So human connections and skills are equally important. And then I always learn this: one size doesn't fit all. So we always have to be flexible. In the future, if let's say you are a teacher in somewhere else, or you are a lecturer or professor in somewhere else, right? It is also important to look into flexibility. One good example is when it comes to the pandemic, everything's changed. It hits a lot of it requires a lot of adjustment at that time. So if let's say imagine that we are not flexible enough, actually the person's actually struggle a lot. All right. And last but not least is stay hungry and stay foolish. So we always need to stay humble with what we have learned and empty the glass also all the time. Okay. So this is my second part. I have one more part, but I would like to invite all of you to also to do some reflections about your own professional and personal life. What's your light bulb moments? Okay. For this, of course, I would like to invite to you all to write something. It is in anonymous, but just write something that you feel safe to share. Okay, that's more important because we are actually at this close group, and all of you know each other. So I hope you all respect each other also. To be non-judgmental if there's something come out, and don't try to, stay supportive if let's say something come out. But most importantly is you only write something that you feel comfortable. Oh, of course, if you choose not to respond, that's totally fine. It's not something compulsory. Okay. Yes, it's true. The courage is really important when it comes to uh, uh, take one more step further and things. Of course, when it comes to compromising, it's important to compromise and accept certain things, and especially limitations lah. So when something didn't go accordingly, so you will comfort yourself if you have time. Okay. Okay, so you try to understand where is the root cause and to reflect and improve, ask an opinions of trusted people. That's great. In those situations, adaptations often involves recalibrating. Okay. My family person really feels as I had to say. Okay. So it must be a tough time for you at that time. So yeah. So I'm seeing you have learned to stay positive and strong, and you bounce back, and you remind yourself. Of course, and this experience I actually also tell you, teach you perseverance and the strengths found within the tough times. Yep, yep. That's the reason I always remind myself and my trainees that no, keep making mistakes as far as you as long as you still have the capacity to hold it. Mm-mm. When we talk about capacity, of course, when you feel at this time and when you feel at 50 or 60 at that time, it's totally different. Yeah. Okay, but it's a tough time for you. Okay. Camping, it's rain. So flexibility. Yep. Mm, Flexibility, reorganize again, get some support. Wow, you all are so good. So, uh, no, yeah, you guys are really great in finding ways out to take care of yourself and very flexible. Mm, pay for my own choice. Still have a long time and road to experience. Okay. What I can tell is we acknowledge the choice that we make, and then yes, it's important to take your time and to to experience and re-experience certain things to feel to break the certain circles or to break certain patterns or to create certain to do something different. Okay. Hmm. Okay. I'm not quite sure. For this person's rushing to meet the deadline and procrastinations is killing me. It's more vivid in my memory. I am a bit unclear about what is this more vivid in my mind. If you would like to share more, you can tell me later on. But if let's say it is a very difficult moments and it's really a challenging time for you, maybe can take a moment to think or take a reference from how other people reflect, see is if there is any things that actually can apply to you also, or if you've already done certain things for yourself and it doesn't work, then it's important to talk to someone also. Okay, I will wait for another one more participants, then I will stop here. Where's the participants? Okay. Okay, so oh, okay. All right. Adjustment. Yeah, sometimes we don't know how what is our limitations until we try it. And I think you try it and you know where are you at the time. So that's where the adjustments comes in and then it works. All right. That's cool. I like all the sharings and reflections. And it's important to keep reflect what things works and what thing is not working. That's also important. And most importantly is stress management and self-care. Also a little bit of self-disclosure about myself. When I was having my setting up my my client my centers and things, at that time I have few things in transitions. I am working in Pantai Hospital. I'm setting up my clinic, and I'm actually at that time I'm still working in the hospitals, in the government. So there are many things that I have to juggle. So I kind of experienced some form of, not some form of, like I am experienced some anxiety. So at that time, so I'm really grateful to have that period of time because I learned what is anxiety, and then I learned how to use that to educate and to understand my client better. Yeah, so that is very important. Okay. And of course, I also learned in a hard way that setting boundaries and understand limitations also very important. Okay, so I learned in a hard way, but it's a fruitful way. Yeah. Okay, I have my last part here. Then I will come to the end of my sharing already. So of course, when we talk a lot of failure, right? We also might be interested to know about what makes therapy feels magical. So when we talk about magical, we have this psychological term called aha moments, right? Like suddenly you have a light bulbs in your mind. Okay, so mentions a lot about why therapy isn't magic. It's not magical because psychology is some or therapy is actually a combination of science and also and arts. It is also a combination of human connections, and most important thing is it takes a lot of time and effort to build it. It's a building process. It's not something like then magic things happens, right? It's just that you are going to exercise, you are going every day, then only you can build the habits, and then you can only come to the goal that you would like to achieve. Then you only can achieve the goal that you would like to, right? So therapy also sometimes feels magical when a client suddenly gets it, right? Hey, how come you feel better already? Right? Because small shift can create, or some small sharing can actually create profound changes. Like for example, just now, my a little bit of self-disclosure about how I experience my anxiety actually do help a lot of clients as I'm not alone and I'm not feeling lonely, and someone's know how it works, right? So they actually I if look into my range of the clients when it comes to there are many types of categories, right? And anxiety, that one anxiety category works the best for me because I know them better in many ways because of my personal experience, right? Okay, so good therapy feels like a magic, but it's also the magic of hard work and insights. Okay, so a little bit of interactions here. So let's make a guess. Magic or method? Let's say these clients with severe anxiety suddenly starts opening up after several sessions of silence. So the breakthrough happens when the therapist shares a personal anecdote about managing stress. So do you think this is a magic or method? Sorry, this one don't have Slido already because out of the capacity already. So I need someone to respond actually. Magic method? Any debates?
Casey, are you able to see the chat function?
Oh, yes, I
Mm.
think so.
The answers are in the chat function. So
Meaning in Slido or
no,
WebEx?
you open the WebEx chat function.
Oh.
There's a speech bubble function.
Okay, okay. I saw all of you already.
Yep. Mm,
Thanks for
mm,
your reminder.
yep. Okay.
Method. Okay. All right. So all of you thinks that it's a method. Okay. All right. The methods comes, I would say, a bit of combinations of human connections and also personal disclosure considered a method. Yeah, so yeah, it is a method, and the magic depends on how, because it's already several sessions, so I don't think it's really magic lah, huh? So I guess it's a human connections and also the therapeutic alliance. Yeah, personal disclosures somehow might help the clients also. Okay, next questions. A client struggling with negative thoughts patterns significantly improve after practicing cognitive restructuring exercise over a few weeks. Okay. For your understanding, cognitive restructuring is when we do a therapy called CBT, cognitive behavioral therapy. So we have this exercise called cognitive restructuring. Basically, it's actually to target negative thinking patterns and how to reframe it or restructure it into a more balanced one. Okay. So what's your guessing or debates? Is this a magic or methods? Okay, now I learned the process already. Come back to you. Okay, where's the chat? Okay. Method. Okay, method. Okay. Yes. For this case, as a scenario, it's clearly method lah because they are using certain techniques. Okay. Cool. All right. Next, last one. A teenager engage with therapy only after the therapist brings in creative tools like art and music, making sessions feel less formal. What do you think? Hmm? Magic? Magic? Method. Mm, okay. All right. Magic. Yes. Again, I emphasize a lot. There's no right or wrong. From my personal opinion, I would say it's also a magic. Because I guess sometimes when we bring certain things in, they feel, wow, okay, that's nice, right? Yeah. Okay. Thanks for all the engagement and participations. Actually, it comes to the end of my sharing already. So, in conclusions or in a nutshell, therapy or building worth living life is a journey of trials, errors, and growth. So, in the future, no matter what you do, or which pathway you would like to pursue, remember this: we don't know what will happen until a lot of trials, errors, and then only the growth comes in. Then only you will know what what forms a life. Okay, failures deepen understanding and build better approach. And then light bugs moments comes from persistence and adaptability and flexibilities, right? Okay, now I would like to throw the floor. I pass the floor back to you all. If you have any questions, then you can ask me.
Thank you so much, Casey, for that sharing. I think if I can start while waiting for them to prepare. I actually have 6 questions, but I choose 2.
Okay.
The most important ones lah. Early on
Mm,
in your session, you talk about talk therapy. So
mm,
if you can give tips to our students, because our students are teachers or soon enough
mm,
teachers to be,
mm,
how
mm.
do they want to? What are the basic things that we can do for talk therapy so that students can open up and start talking? That's one question. And then the second question is, um, how do we come to the realization that a student that we have probably needs help, and the best way is actually to get help from uh, a therapist or a clinical psychologist? At what point do we start recommending that um, that recommendation that this student be referred to a clinical psychologist. And if I can add the third question, you also mentioned just now, theory on the book is very different from actual real life. So if you could share with us probably one theory that you learned in class that doesn't quite work when you try to implement it in real life.
Well, the third question is a bit need a little bit of time to think about it. One is like, oh, I need to think about
Yep. Yep.
Okay, all right. Okay, the first question.
Do you want to unshare first? I mean, because I'm seeing myself on the screen, so yeah.
Oh, okay.
Yep.
Okay, so the first question, I already remember the second questions right now because it's still vividly in my mind right now. So I answered that one first. So comes to what point we will actually suggest or give advice that maybe the students or friends that around us need certain help. Okay, so okay lah, let's talk about my friend first. How I gauge, right? Sometimes when it comes to a certain extent, you think that it's out of your limitations to help. For example, you feel certain tensions, or even I myself, when I hear certain things that I think is maybe it's repetitive. If let's say because I train to know what are the signs, but probably you all are not. But what you all can gauge from the first sign is unusual behavior. Is this person has certain unusual behavior or not compared with last time? Then second, the mood itself. Is there any behavior including interactions or withdrawal? If this person's that I always ask and then suddenly like MIA, right? No, I have a question mark in my mind. How come this person suddenly hilang, right? And then if I'm constantly hearing from this person from last time, maybe he or she was shared certain thing, but things change. So still go back to how sensitive we are to pick up the change and how you feel when you hear from them. Is that heavy for ourselves? Is that something we can cope? Is it because sometimes we also learn to be patient, especially all the teachers are they're very patient one. So they are patient enough that to the extent that they felt it's too heavy, then that is actually a very clear sign that something is not right. Yeah, because perhaps it's our limitations already, the capacity because of the professional training and things. Sometimes we do offer help, listen them properly, being empathetic. Those are the skills. But eventually it comes to a point where, hey, is this something that I'm doing okay? And is there something that is my job in that sense? So actually can refer out already. So mood observations, behavior observations, and then also can gauge on the energy level. If this person's always in the lower energy or always hyper to certain client cases, so we can observe from there. And also can see their appearance. For example, are they kept or unkept? How they take care of their personal hygiene. So we say, something is not right. This person is like, they always like to comb their hair or anything. But how come this is becoming so messy already? What's going on? No, we always have a question mark in my mind, our mind already. Then it's a good sign to tell something is not right. Okay. I think I link it back to the first questions. What kinds of techniques that actually for the teachers to support? I guess I'm not quite sure the framework of because it's a different field. So I'm not quite sure whether basic counseling skills is part of the framework or syllabus. So, but in general, as a human being, we can always be patient and listens. We listen first before we give any response to understand and analyze first. And then we give whatever supports that we can. In therapy, we try to don't give a lot of advice, but we listen what's going on first and understand the intention of certain behavior or feelings. So go back to listening skills.
Understand.
Because in
Okay.
this world, right, there are so many people like to give a lot of things.
True.
right? And only minority of people will really sit down and listen properly.
Mm.
Mm.
Agree.
Properly means if let's say you know the Chinese word 聆听,
Mm.
the 聆 part is use your ear to listen, use your heart to
Mm.
feel.
Mm.
That is
Mm.
empathetic listening. Mm-mm. I think I answered your first questions also.
Indirectly.
Right?
Thank you so much.
That's my memory and my attention.
No, listening skill. Mainly you coming back to that point of listening and linking
Yep.
things up.
Yeah. So the third one, theoretically, let's say, mm, I'm actually trained in cognitive behavioral therapy means
CBT.
it is a modalities comes from thoughts and behavior approach.
Mm.
Uh, to some clients, it might be not working, even though
Mm.
you follow even though you are being more flexible in certain therapy protocol already. So for example,
Mm.
in CBT, we have a lot of assignments and action plan. They have to do assignments, do
Mm.
homework, their reflective work.
Mm.
And most of the time I don't really follow in that sense because I know some clients they don't like to write things. Then I will do it in my sessions. I'm
Mm.
being that flexible already, but still have a pool of people. Talking therapy or CBT may be not helpful. So for
Mm.
example, they maybe only engage to with emotional focused therapy. They only highlights on emotions. Maybe they are
Mm.
looking for a certain supportive. They don't want any therapy also, right?
Mm.
So that doesn't mean that the framework is not working, but more like misalignment. I would say. Mm-mm.
Mm.
That's why we have to always reflect on the protocol and the structure. Mm-mm. Uh, because certain therapies is just not working with the clients. That's why we have and also the school of thoughts, right? We emphasize a lot of thoughts and behavior. But some group of people they want to know about their early childhood, so that one is different modalities already.
Mm. Mm.
Okay,
Mm.
but the real life messy how can link decline and incline from the theory and practice. I will still think theory is the framework lah. Huh? We cannot like jump out from the theory one. Because
Mm.
for example, Eric Erickson's theory, we know all the stages and things. So no
Yep.
matter what modality we use, we can still refer back to the framework. Hey, this client is know which stage this client is and thing. And then we can do a little bit of analysis. Well, which part of the stage the client stuck at the point. Then how can we use different modalities to help the clients? That one is the skills already lah.
Mm.
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 So we still have to learn theory no matter how.
Thank you for saying that.
Mm.
Because sometimes students didn't realize that the reason why we teach theories is for you to have a certain way of thinking, a structured way of thinking.
Mm.
You don't jump around and find answers without
Yeah.
following through a set of
Yeah.
like
Yeah.
uh
Yeah. So we still need
hooks lah.
something to refer on. We still need
True.
have something like to because it's a frame. If you don't have a frame, it's like all
Mm.
over the place already. We still need some
Mm.
boundaries there. We still need some frame there to protect.
Mm.
For like I mentioned earlier, if one thing doesn't work, we can change another thing. But I also
Mm.
tell my trainees, you don't change, go and train the different therapies. You know, if you are not trying enough already, you are trying like you change totally opposite 360 difference, right? Then that means that you are not following the theory, or you
Mm.
may not
Mm.
understand the theory enough.
Mm.
Uh,
True.
uh, yeah, you
Thank you,
only can
Casey.
change when you know enough what you are doing and you are abiding to the theory.
Yeah, there's a basic thing that you need to do first before you switch.
Yes,
Mm.
yes, yes. So still very important. We live in a world, not only the textbook, we also live in the world with rules and regulations. So certain boundaries so that we have to
Mm.
follow. House also got house rules. What time have to
True.
go home lah, this and that lah, what can do, cannot do It's common,
Mm.
but just adjust according to different age lah.
Mm. Mm.
Mm-mm. Okay.
Thank you. Eddie, guys, do you have questions that you want to ask? You can unmute and ask Casey now. Take the chance to ask that, because it's not often that you get a clinical psychologist to come and talk to us. Anyone?
Good afternoon, Miss Casey.
Hi, hello.
I have a question, and suppose you have a client who's in middle school or high school, and he is still an adolescent, and he sometimes in emotional depression, and he hates for school, and the causes of the emotional depression is because such as the teachers, the schools, and the grades, the lack of knowledge or poor effective ways to educate mm, the child for the parents that lead to the emotional depression. So, what suggestion will you give to these kind of students?
Okay. As a teacher's role or as a professional role? As my role. If let's say I
Yeah,
imagine I'm a teacher's role.
as your role.
As my role, okay. If this client come to me, so what I will do is start with the assessment first to see how severe this student is in terms of depression, because depressed is a feeling, it's not a disorder. So to a certain extent, we have when things didn't go accordingly or against our way, of course we will feel upset and feel depressed to certain extents. So depressed is a feeling, but whether or not it's fulfilling certain criteria that becomes a disorder, for example, how impactful the depressed affects the functions, academic functions, can he or she studies or not, can focus at class or not, and things like this, or in a relationship with these persons that are making friends or starting to show withdrawal from the groups, for example. And then and because you also mentions about a little bit of systemic perspective, how the environments also influence her. Okay, so that one is secondary issues that I have to target. So when these clients come to me, I will do assessment first to know where is he or she, and then to either start with certain interventions or supportive role if let's say very severe, to the extent, for example, the depressed that maybe include suicidal thoughts, then I probably will actually refer to the psychiatrist to further evaluate to evaluate more thoroughly when it comes to mental health status. And if needed, they might be given certain medications to help them. Because as a therapist, I know my limitations, that there are people who needs medication, they really need to take medications. We don't know, we know and we train to do something, we also train not to do something. We know our limitations. So it depends on the students severity first in terms of the mood. If I answer your questions, Xing Yue.
Yes, I understand it. Thank you.
Yeah. In terms of whether or not the systemic the environment factors that bring certain influence, I will also take a further step to talk to to help the clients to extend their resources. If not, these clients will be very lonely also, right? Fighting this feeling alone. So it would be nice to have someone to understand her condition. If cannot, then maybe as a teacher, we can always be there to support, and but also to tell them it's important to reach out for professional help.
Okay, so in general and be be patient and listen to.
Yeah. So in any point as a teacher, if let's say we feel heavier, you feel like maybe we also got affected by certain feelings, then it's time to stop already. Then have to get someone's help already. Because I hear a lot of teachers actually very struggles because nowadays there are many teenagers and there are many issues out there.
Yeah.
A lot of people struggles from mental health conditions but it's either being identified or not identified. So and the school counselor is the ones who they always reach out. That's why school teachers are very stressed also. Yeah, let me acknowledge all of you. Yeah, you guys are great. Teachers are really stressed. Okay. So yeah, but if let's say you hit the limits that you think that can't help, get someone's help. Yeah, that's the most important thing. Yeah, there is always people can help one.
Okay, thank you.
Yeah.
Okay, thank you, Senior, for that. Anyone else has question? Okay, you may not think of a question now, but I think probably there might be questions that come out to you later on as you reflect through your session. So if you have any questions, guys, I think you can reach out to Cassie. Cassie, you have given me your email address, right? And that the permission to actually share your email. So probably you want to talk about your own setup.
You can see this screen. If let's say you would like to
Yes,
know
yes.
more, you can actually drop the message here. But just mention that you attended this talk, then I know I will be the one who attend because this is a general line. Of course, do some marketing lah. So feel free to like and share the Facebook page and the Instagram page if you like the sharing and things, or if you like to further connect with us. Yeah. So I'm really, really thankful to be here today. Thanks, Doria. It would be nice if let's say I can catch up in anytime soon. If I'm in JB or if let's say you are here in KL, so that would be nice to meet up. And for the rest of you all, it will be very nice to. It's really nice to meet you all here. Although I don't see some faces lah, but it's good to have you here today already.
Thank you so much, Casey, for sharing your service. Guys, this is also a call for you. If you need assistance that you cannot get from your friends, or you just want to talk to someone, just reach out to Casey and her team lah. I think probably they might be able to help you out. Coming from, okay, this is self-disclosure, coming from somebody who has gone through therapy sessions before. It is really helpful if you just need somebody to help you figure things out. Casey and her team might be very good for that purpose lah. Okay, so no, thank you for coming and agreeing to come to my class. Just for you guys information, Casey actually recommended Jason. So yeah, I also have to thank you, Casey, for bringing Jason on board because that's another session that we really enjoy actually.
Okay. That would be. I think he will be very happy to hear that. But I'm glad that we can be part of it. Yeah.
Thank you. So let me stop sharing. Stop the recording now.
Okay.